I'm Ruth O'Regan. I'm a professor and chair of medicine at the University of Rochester. When you send off germline genetic testing on patients, sometimes what you'll get back is a variant of unknown significance in a certain gene. So, for example, BRCA1 or BRCA2. And what that basically means is exactly what it says, is we don't know if that variant is associated with an increased risk of breast or ovarian cancer. So I think just looking at this kind of globally, the issue is that we all see patients who have who have like breast cancer themselves, have relatives with breast cancer, and we send off genetic testing and we don't find any mutations. Does that mean they don't have a mutation? Absolutely not. It just means that we haven't got the technology at this point to detect the mutation that they have, and they still obviously would be considered at high risk, or their relatives would be considered developing a high risk of breast cancer. So it's really the same thing with the variants of unknown significance, or VUS as they're kind of shortened. What it basically means is that we just don't have enough information right now to know whether they predispose to cancer or not. And that's why these registries and studies that are done looking at these genetic alterations are so important, because if you find a VUS and it's common in, or if you test enough patients and you find enough patients, then you can actually look and see if indeed it does predispose to a given cancer. So what I would say is, I think it's very important that we continue to test patients and do a lot of research in this area, because there's no question that we're going to find other genes that predispose to cancers. And obviously that's incredibly important for patients to know, because if you know that a mutation that's present is associated with breast or ovarian cancer, or indeed other cancers, there's a lot of things you can offer patients, particularly, prophylactic surgery or chemopreventive measures. So overall, if a patient gets a report back with VUS on it, what that means basically is we just don't know whether they have a predisposition to cancer or not at this time point. And what I would tell a patient in that scenario is that, we're continuing to look at these VUSs, and ultimately, when we have enough of the population that have these VUS, these variants rather, then we'll have an idea of whether they actually are a mutation that's going to predispose to a cancer.